Welcome to The Political Mechanic. My name is Stephen Thane. A key issue in the Idaho legislature this year is Medicaid expansion, which began in 2018 to provide health care for the able-bodied poor. At the time, I wrote a book about the dangers of this plan called The Road to Venezuela. Government programs like Medicaid expansion need to be phased out and transformed into initiatives led by the private sector with volunteers and private funding. This transition should be strategic and thoughtful, ensuring recipients can move towards self-sufficiency without sudden disruption. Large-scale federal poverty programs have failed, harming both the poor and the nation. High crime, intergenerational poverty, and broken families are often associated with these communities heavily reliant upon these programs. Systems that weaken family structure are not charitable, wise, or sustainable. A volunteer in India working with a leprosy colony once relayed an insightful lesson. Quote, "Nothing given free has any value. Every time you give something to a person, you diminish that person. Medicaid expansion operates under the same flawed assumption. People must have a role in providing for their own needs to maintain self-respect and progress. Society should not simply give, but rather offer opportunities for individuals to contribute and move beyond poverty." The Founding Fathers prioritized opportunity over wealth redistribution, creating an environment where individuals could prosper through hard work. We must rediscover and embrace that same philosophy by rethinking our approach to public assistance. To introduce this new perspective, I support efforts to roll back Medicaid expansion, particularly House Bill 138, sponsored by Representative Jordan Redman. This bill provides a structured approach to reform while promoting financial sustainability and self-sufficiency. Two key principles guide this effort. First, individuals gain control over their lives by assuming responsibility for their well-being. Institutions should support independence, not dependency. Second, transitioning away from government dependency requires time and careful planning. We have not been able to have this thoughtful discussion in the past because the federal government has been dominated by those stuck in the old help the poor mentality. President Trump has brought in fresh thinking, so our approach to helping the poor can take a new direction. House Bill 138 targets able-bodied adults of working age and includes provisions to phase out Medicaid expansion unless certain conditions are met, which are, first, the Idaho Department of Health and Welfare must seek federal waivers to modify Medicaid expansion. Second, Medicaid expansion will end on July 1st, 2026, unless the federal government continues covering 90% of the costs, a 20-hour work requirement is implemented, enrollment is capped at 50,000 individuals or limited to the number of Idahoans over 65 enrolled in Medicaid, improper payment rate falls below 5% of total expenditures, enrollment is renewed biannually, and a lifetime benefit limit of 36 months is established. This bill ensures oversight and accountability. If waivers are not secured, the expansion will be discontinued, preventing unchecked government growth, since it grew from 40 million as anticipated to over 100 million today. With a new administration in Washington, now is the time to pursue these reforms. Additionally, private sector organizations should assist individuals transitioning out of Medicaid by providing workforce training and skill development. Instead of perpetuating dependency, a targeted strategy should help people achieve long-term financial independence. Ensuring healthcare access is important, but it must align with the principles of personal responsibility. House Bill 138 offers a path to achieve this balance. If you like the content in this video, please hit the like button and subscribe.